It is so great to be here with all of you today. And I think it must be a marker of how long ago it was when I got to speak to you a little bit a few months ago during your other conference. Since then, I think my bio has been updated that Dr. Aragon is now our State Health Officer and Director, but I'm still here with all the titles you've heard at the State Epi and Center for Infectious Diseases. I also just want to thank you all again for all the work you're doing on the front lines. And clearly the disparities we're seeing in health outcomes in Black infant and children and Black women are just unacceptable. And I think all the improvements we've made in California are largely due to all of you and your leadership. I also think something that was just mentioned, as far as Dr. Burke Harris, she is a trusted leader, and it's not lost on me that trust is really so important in where we are right now, I think, especially in this pandemic. And I know there are many reasons why public health and healthcare have not gained trust in the Black community. And I think really so grateful again for all the work you all are doing to work on that and be those trusted leaders and work with trusted leaders in your community as well to help do what we all want to do, which is improve health outcomes and health and wellness for our Black Californians, and especially such a core focus on our infants and women and children, which are just, again, crucial to the community. I'm going to throw a lot of data at you, that being said, because I want to make sure you all feel informed and you have facts. I'm going to go through a lot of slides with a lot of sort of numbers and data. I'm going to try to just do the highlights, and then of course you'll have these slides, and then try to leave most of the time for Q&A as well. So just wanted to preface that I am throwing a lot at you, but again, I want you to have that, but I know it's so much more than just data, but I want you to feel like you have a lot that you can use. Next slide. So this is just a quick snapshot of sort of where we've been, where we're going in the pandemic itself. So the blue line is kind of the different surges or waves of cases. So the first bump there is our last summer, and then the big huge one is last winter. And then you can see kind of where we are now, which thankfully, this is our Delta surge, this third peak here of the cases. And thankfully, it looks like we are coming down as a state. There are certainly certain areas, those of you in the Central Valley know, you're still seeing a lot of cases and a lot of hospitalizations. But I think a lot of the other parts of the state are thankfully seeing kind of still very high transmission rates and high case rates, but at least on the decline. On that note, the orange line is hospitalizations, and then the black line is ICU, and then the red line is not to scale, but the deaths, and just see how they kind of lag in timing. Hospitalizations and deaths often lag when they peak after the cases. And I think it's worth briefly noting as well that despite our surge of cases being higher than last summer, our hospitalization peak is a little bit higher, but not nearly proportionally as high as the winter. And ICU also is not that much higher. So I do think that is a huge, the contribution to that is vaccination rates. And that's what these orange lines are, just showing when we got to the 4 X's, or when we got to 60% of 16 and older vaccinated. Next slide. And then to sort of show you what our trends are more recently, just through this recent spring and summer. And as you can see, again, the 18 to 49-year-old age has been the highest case rate, highest increases in incidence. And of course, that would be women of childbearing age is included in there. And then 0 to 17-year-olds is actually was a lower compared to the others, but has gone up higher. Next slide. And then looking by race and ethnicity. So again, early on in the pandemic, and actually in our first surge, we saw the most disproportionality in our Latino population, also in our multi-race and Native Hawaiian Pacific Islander, and then especially during that second surge. But now actually you can see here that what we're seeing now in this most recent surge is the biggest increase has been in African Americans as far as cases. So that's extremely concerning. Next slide. And then this is just another way of looking at the disproportionality we're seeing. So on the left side here, just showing again the different race and ethnicities as far as overall cases and infections. And you can see, especially in our 0 to 17-year-olds, so in our kids, we're seeing a much higher disproportionate risk of infection of African Americans compared to whites, and across all ages, but it's of course most marked here in our 0 to 17-year-olds. And then just got some updates from our team on the pediatric deaths. I think we've only had 33 deaths in California due to COVID-19, but that is, deaths too many that are now preventable. And then you can see here this disproportionality again, that while, as you know, African Americans are only about 6% of our California population. We're having 18% of our deaths, our pediatric deaths, are in Black children. Next slide. So how does that compare to vaccination status? So in many different ways that when we slice and dice the data, we're seeing an inverse proportionality between overall cases, hospitalizations, ICU with vaccination rates. And so how are we doing on vaccination status by race? So we made a lot of progress. We were at 37% of the Black population in May, and we've increased 18%, but we're still only at 55% of our Black population is vaccinated. And you can see again, this is one of the lowest proportions we're seeing across race and ethnicities. Next slide. And then looking at race and ethnicity by teens and women of childbearing age, you can again see here, this is for the at least one dose. And that 12 to 15-year-olds, it's our lowest rate as far as our African-American proportion vaccinated, and then women of childbearing age is the second to lowest. Next slide. So really excited with the leadership of Dr. Radhakrishna, who I believe was mentioned earlier and is on the call, our new Deputy Director of Office of Health Equity, that we are working on some really important gaps to close. And so we're looking at them a couple different ways. And our goal by the end of this year is to get to 75% of eligible individuals across all races and ethnicities to get at least one dose of vaccination. And our other goal is to decrease the inequities. So looking a lot of you have heard of us talk about our Healthy Places Index, which is a place-based way to look at disparities, as well as working with Medi-Cal and looking at insurance types. And we really want to close those inequity gaps by less than 10 percentage points by the end of the year. So you can see we have 20% to go as far as our Black vaccination rates. And then when we try to look at the actual numbers, it's about 386,000. So we're really trying to map out what that means by week to get to our goals by the end of the year. Because again, we want to close these gaps. We want to improve vaccination rates so that we can actually decrease the numbers of infections we're seeing and hospitalizations and ICU and deaths. Next slide. So shifting away from sort of our epi and our data, I know some of the common questions that came up that I just thought would be helpful to maybe talk through in the beginning here is just again about like how does sort of the FDA approve vaccines? What are the different phases? So this is a nice infographic. And just to briefly highlight, there are different phases. So initially it's a much smaller number of healthy volunteers just to look at safety. But it's a very small number. And then as you go through the phases, you increase the number of people, look at sort of side effects, and then also looking, the different manufacturers each have to submit a certain minimum number of volunteers to do the safety and efficacy numbers. And it's a very rigorous process. Certainly things happened quickly last year in order to get us vaccine out as soon as they could. But a lot of the things that really were expedited were the manufacturing side, not the data collection or the data analysis. So I think that's a common thing and a common concern of people as well. Were they rushing things? Were they not doing the data analysis closely enough? Did they skip steps that they normally would do to approve vaccines? And they did not. And again, a lot of this sort of Operation Warp Speed was really about increasing the manufacturing and getting it ready to go so that as soon as we had good data to show safety and effectiveness, that we could get things produced and out the door. Next slide. And then I think what's even more compelling and important to know is that now, after the clinical trials and after licensure and emergency use authorization, we have over 200 million doses have been given in the United States to date, and almost 180 million people have been fully vaccinated. And we have a lot of different vaccine safety monitoring projects and programs across the country. And vaccines are actually monitored much more closely than a lot of other drugs or other medicines that come out. So these are 4 different major projects. And actually what's also important to know that we're so lucky here in California. Not only do we have Nadine Burke Harris as our amazing Surgeon General, but we have the center, one of the centers for the vaccine safety data networks and the CISA project are here in California. We have some of these advisors that are on our Western State Scientific Safety Review Group. So there's just a lot of really great data and a lot of data now that's been compiled on pregnancy and pregnant women that we can talk about later as we do Q&A. But just want you to know again that there's a lot of safety monitoring that happens. And the VSafe program, I'll just quickly put a plug for it. When people get vaccinated, you can get these, if you sign up for it, it's a volunteer thing. But I got a reminder the other day to have another like input on what are my side effects? How am I feeling? Do I have any side effects? And they're trying to gather data from volunteers that way, along with also getting any reports of adverse effects and safety. And then the clinical CISA is like looking at very closely doing a deep dive on any adverse effects that get reported and clinical consultation. Next slide. And then I know another really common sort of myth we've been hearing about is vaccine infertility. So this is some background on it. The short version is there is no evidence that COVID vaccine, or actually any other vaccine for that matter, causes any impact on hormones or fertility. This is a little bit about the background of why this myth arose from this vaccine specifically. There was a thought that maybe a placental protein was similar to the spike protein in this virus, but actually they're really different. And there's studies, again, ongoing studies that really show that there is no impact on fertility. I want to keep moving because I know we're running out of time. So the next slide is just resources. And I want to, again, thank a lot of you. I know many of you have been working with our communications team to develop some of these resources and some of the things that we've put together. And then these are some other websites for other websites and other places. So I will pause there. Thank you.
Thank you, Dr. Pond. And so this is a reminder to everyone on the call. If you guys have questions from her presentation, please drop them in the chat or jot them down, and we'll do open Q&A at the end of their presentation. And yes, I saw a question now. Will the slides be provided? And they will be. So now we'll transition over to Dr. Burke Harris.
Thank you so much, Nambi, for having us here today. And thank you, Dr. Pond, for kicking us off. You know, I just wanted to start by sharing, for me, one of the most meaningful experiences that I ever had was when I first started my clinical practice in Bayview Hunters Point in San Francisco. And I had the opportunity to facilitate a class at BIH at the Hunters Point YMCA. And we got a chance to sit in a circle and talk about the joys and struggles of being a mom, everything from breastfeeding to being a single parent, everything in between, nutrition. And I had the opportunity to witness firsthand the amazing connection that BIH has with our community. And for me, what I was so struck by is that that's where health happens. That is how we provide the tools and the resources to help our pregnant and parenting women be able to be the moms that are the foundation of our community. And for me, that was something very powerful that I brought with me when I came into this role as California Surgeon General, because as we have been looking at the data that Dr. Pond presented and really working together to come up with strategies as to how we in the state of California can reduce disparities that we are seeing, one of the critical pieces is working with community partners, working with trusted members of the community who have those relationships. Those relationships are invaluable, and especially during a pandemic. And I think that for myself, as we have been looking at this data and thinking about what are some of these strategies, I will tell you that it kills me when I see that the rate of vaccination is lower among our Black and Brown communities, especially when we see that the rates of death, for example, are higher. And we understand that one of the biggest parts of this challenge is that all the barriers and all of the erosions to trust, all of the violations of trust that have happened historically, and frankly, that are still happening today, right? As I look on this call and I look around at all of the beautiful faces that are part of this conversation, I can imagine that probably most of us have had an experience of going to see a healthcare provider and having that experience of not necessarily being treated as well as we deserve to be treated. So this is not just an issue of things that have happened historically, but I think that for a lot of us, the experience of what's still going on every day, and to recognize how those harms are leading to mistrust of, you know, the most powerful tool that we have to fight this pandemic. And so being able to combat that harm with the power of the relationships that we have, that you all have in the community, is so important. And so for me, that's why this is so incredibly important, these conversations, and making sure that you are armed with the resources, the information, the data, any of the above, and that frankly, that if you all have questions, things that you're wondering, any, you know, whatever it is, that we are here to answer those questions and be a resource to you all, because you are such an important resource to our community. And with that, I will just take a pause to make sure that we have a lot of time for Q&A.
Thank you, Dr. Burke Harris. So I see, Maya, you have a question. We're gonna go kind of quickly through the questions that were sent in, but then I got your name down. We'll go to you first once we're done with that. So I'll start with the first question that Dr. Pond went over in her presentation, but was a question that was asked of our site. What are all of the steps taken to ensure safety and effectiveness of the vaccine?
Nadine, do you want to follow up, since I kind of...
Yeah, sure. I'm happy to jump in there. Yeah. So as Dr. Pond mentioned, the process of developing the COVID-19 vaccines was literally the exact same identical process that is used to ensure the safety and efficacy of all vaccines. And so obviously, because it's a global pandemic, right? People can't go to work, like, you know, that the government put a lot of resources into reducing many of the barriers that typically make the process of developing vaccines take a long time. And so that's how we were able to move very quickly through the development of COVID-19 vaccines, because let's see, every government in the world was focused on trying to solve one problem, which is how do we vaccinate people against COVID-19. So we had a lot of international cooperation. We had a lot of resources that were pouring into it. And you can imagine, if every government in the world were trying to solve one problem, it gets solved a little faster. At the same time, the process that was gone through for the vaccines that were approved for use in the US was the exact same process. So as Dr. Pond mentioned, phase 1 trials, phase 2 trials, phase 3 trials. And then even after going through that process, looking at the data, saying, is this safe? Is this effective? Then after implementation, there's a couple pieces that Dr. Pond talked about, but I want to emphasize again. One is the VAERS, As a pediatrician, I'm extremely familiar with the VAERS. It's a vaccine adverse event reporting system. And that's primarily for doctors. Anytime someone comes in, like if any one of us, any one of you has a side effect, and you go to your doctor and you say, hey, you know, I'm having this problem because I'm having this problem and I got vaccinated 2 weeks ago. Do you think it's related? Right? That vaccine adverse event reporting system is something that every doctor is trained on how to update the information to say, I had a patient, they were vaccinated 2 weeks ago, and now they're having headache, or now they're itching, right? Now they're whatever it is. And then that goes into the VAERS system, and the CDC and the FDA look at that data to see if there is an association there. Because you can imagine sometimes there are some things where it happens after a vaccine. Some people feel like, oh, I got vaccinated and then, whatever it is. And there's something that doesn't have a relationship, but that's how that analysis happens. The other one that I really want to encourage actually everyone to take advantage of and use is VSafe. And that's for consumers. That's for your average everyday person. So you can go on the VSafe website, and after you get vaccinated, everyone is encouraged to say, okay, I got my vaccine on this date. And the VSafe site will actually, send you updates and say, hey, how are you doing? Are you having any symptoms? Anything going on with you? And that's the way that we collect information from average everyday people. And the CDC and the FDA are always looking at this data to see if there is an association. And so these are some of the tools that we're using to understand if the vaccine is safe and effective.
Thank you both. So the next question is, where would we find information about the differences and similarities of the COVID-19 vaccines offered by Pfizer, Moderna, and Johnson & Johnson?
Should I take that one? So there's a couple, there's many different places, but the places I would recommend going to are both the CDC website has a little comparison of the 3 different vaccines that are licensed or that have the emergency use authorization. Actually, Pfizer is now licensed, as you may have heard. And then we also on the CDPH site, and we can put some links in here. I believe someone's going to do that in the chat as well for CDPH. There are these very long, like 7-page consent forms for the when you're doing your consent for vaccination. And so our communications team, and again, hopefully have been able to get input from some of you, have been updating these fact sheets to make them a little more user-friendly, shorter. And also we have one fact sheet that talks about which vaccine is right for me. So those are a couple of the main resources that we would recommend.
Thank you. And so our next question is, COVID vaccine clinical trials, specifically in pregnant women, are still ongoing. The question arises, should we wait until there is viable data before providing specific messaging surrounding the vaccine?
So I'm going to jump in on that one and say, initially when the CDC came out in terms of looking at messaging and recommendations for pregnant women, initially the CDC came out and said the vaccine is safe for pregnant women, and that was what the position was based on the available data. And then, as you may know, last month, I believe it was August last month, the CDC changed their recommendation. They updated their recommendation to say pregnant women should be vaccinated. And the reason for that is it was the result of several large studies that came out that showed increased risk of severe disease and death among pregnant women. And when we look at, so I just want to, one of the things that I think is really important is that when we think about getting vaccinated, we think about it's like you're doing something, you're taking a step to do something. And so the concern is, what if you take a step to do something and there's a risk associated with that? But one of the key things that we now understand is that it is more dangerous for pregnant women to remain unvaccinated than it is for them to get vaccinated, than any risk of vaccine. And what we see, I don't know if you guys saw it, but there was a recent article that came out here in California about a woman who was pregnant. She decided not to get vaccinated because she wasn't sure. She was concerned about the risk. She ended up getting COVID late in pregnancy and ended up passing away and never getting a chance to meet her baby. And that, when I read that article in the news, it just, again, breaks my heart, because that was entirely preventable. You know what I mean? Like, if she had been vaccinated, her risk of death would have been, very, very, very low. And instead, unfortunately, her kids don't have a mom. So I just really want to emphasize that not getting vaccinated is not like doing nothing. It also comes with risk. And I think that's something that's really important.
A couple of just quick things. Oh, just to add to that, I think that is so important to also realize that in general, and I'm sure many of you know this, but pregnant women, are at higher risk for a lot of infections as far as the serious outcomes. So flu, hepatitis, and definitely that is true for COVID-19. So that is why it's really felt that, especially now that we have so much more safety data, that that really the risks absolutely outweigh the risk of COVID infection outweigh and the benefits of vaccine are so good. I just put in the chat too, just some of the numbers that have come out post-licensure now too, that we have that really kind of show hundreds of thousands of pregnant women who've been followed, and that there's no increased risk of miscarriage between women who vaccinated or not. So there's just more and more data. Again, since we have, over 200 million people have gotten at least one dose, we've got a lot of data we've collected now.
Okay, next question. Let's see. Okay, how many Black pregnant women have been included in the clinical trials? And I'll also kind of expand on this question too, because I saw a related question in the chat. Where is it? I just saw it. Oh, where were the pregnancy studies conducted? Were Black American pregnant women also a part of the study?
I actually need to look up, at least from what I know, about what proportion of some of the numbers I just put in the chat, especially from this recent data, what proportion are. And I think, Nadine, we talked about 10% in the clinical trials were African American. I think the pregnancy, though, really has been much more after the approval that we've seen more and more data. So we can get back to you all too to find out, of the thousands of women that are being followed, what proportion of those are Black women. But I think there's definitely a very significant proportion.
Thank you. And then I know that you touched on this in your presentation as well, but we'll ask again here, are there potential impacts for infertility, sterility associated with the vaccine, and who is monitoring this?
So I'll just jump in again, from my slide at least, that so during the actual phase 3 studies, there were 36 women who became pregnant. That were half in the vaccine group and half in the placebo group, meaning the group that didn't get vaccine. And there's been no evidence that there's been any change in birth rate in the US. And again, there's this myth basically because of the people were concerned that there was a protein similar to placental protein in the spike protein in the virus. But it's almost like saying two people are sharing the same social security number because they both have the number 6 in it. It's like they're very different actually, but I think that was one of the reasons that this myth came about. And it's been, for a lot of other vaccines too, people have had questions or concerns about hormonal impacts. I've heard colleagues talk about hearing worries about menopause or puberty in young females, but there's really no impact on any hormonal and no physiological reason to believe there's any of that impact. But definitely all of the data is overwhelmingly that there is no difference between vaccinated or unvaccinated people.
Thank you. Next question. How do we reach our families to get them to accept the factual information without them feeling like we are applying pressure to them and scaring them with this information? So are there any best practices or strategies that you both have or know about that could help us kind of relay the message more for our families?
I'll start by jumping in, there are a couple. So one that's really important is understanding what their concerns are and understanding kind of where those concerns are coming from. And one of the big challenges, so unlike I think with a lot of other communicable diseases, I mean, there's always misinformation and health misinformation out there, but there's like a genuine agenda of misinformation when it comes to COVID-19. And that is, it's really unfortunate. I think it has to do with it has lots of reasons for it. Some of it has to do with politicization, some of it, other reasons, but there's a tremendous amount of misinformation out there. So the things that I would recommend is, number one, to start by, although I don't know, maybe some of us, and I think that it's easy, I've definitely experienced this, it's easy to feel frustrated when people don't want to get vaccinated because we're kind of all in it together, and we all need to be vaccinated to protect the entire community. But I think number one, starting with that listening, starting with that kind of coming from this non-judgmental place, and then understanding if there's any misinformation, and really helping to kind of gently correct any misinformation that's out there, helping people understand, what's the reality around safety and effectiveness, what's the reality around impacts on fertility or birth, but what I found, generally speaking, is starting by listening and coming from that, really tapping into that genuine concern that we have for other folks. And then the other piece, and I think this is particularly special for BIH, is recognize that we have relationships with people, right? And we all know that those relationships, they part of being in relationship with someone is that, hey, okay, they may not go with your recommendation the first time or the second time or the third time, right? And that was my experience when I was working in Bayview Hunters Point. It didn't even have anything to do with COVID, but there are a lot of times where I was recommending something to a patient or a family and they weren't ready, or they weren't interested, or they weren't whatever, but they know I'm on their team. They know I'm looking out for them. They know that I've got their back. And so eventually when I bring it up the fourth time, they're like, all right, okay, yeah, I'll do it. And so really being ready at that moment, that for whenever that yes comes, making sure that the barrier, the distance between that yes and actually getting the vaccine is as short as possible. So those are some of the things that I would recommend.
Yeah, and I think the only thing I would add, which is a similar theme, but I think just to reiterate, I think, yeah, listening, really trying to understand where the concerns are. And I think, I'm sure all of you are very good at just really wanting to hear that out. And because as Nadine pointed out, I think there is some, back to like, there is some messaging out there that is really, unfortunately, I think, anyway, painting unvaccinated in a certain light. And I think that's not where we want to come from public health. We really, we want to meet people where they are, understand where their concerns are, and try to address them. And then I think trying to connect, it's going to be very different for me with different patients that I might see or different people I'm talking to, but trying to understand like a common, and this is something that has been shown to work with other sort of vaccine hesitant parents too. I think really kind of, we both want what's best for your child. We both want your child to be healthy, or you to be healthy as the pregnant woman. So I think really trying to find those common goals or common outcomes and seeing where you can align that way. And then I think, again, really the bottom line is, again, the trust and the relationship. So that's where, again, I think all of you and then the people you work with are so important, because it's one thing for, a public health official to come out and say something, in the media or on a PSA. But I think for you or people who are taking care of your clients directly to really be working on those repeated messages and repeated things around, how do we get to what you want, which is the best, outcome and health outcome. And here's what we know about how you'll get there, or trying to address, again, any concerns or issues they have.
So I have a friend who's been working as a nurse in the taking care of COVID patients since March 2020. And I get, updates from her. And she was explaining that this new variant is even more damaging to the lungs and cardiac system. Do you all have any information to elaborate on that? Like the new, I guess, advances in the actual virus, what it's now doing to our bodies?
Sure, I can start. So the current variant we're seeing in California, certainly, and really nationwide and actually around the world, it's called the Delta variant. They've been naming a lot of the different variants now after Greek letters. So this is the Delta one. And it is true that we are seeing it's 2 times as infectious as the one we saw in 2020. And some of the theories and some of the emerging data is suggesting that potentially it's more likely to cause hospitalizations. And some of the thought behind that, to get a little bit technical, is that it's even stickier, like when it's trying to get into the receptors in your body, and it can it's like there's more of, actually the other thing is there's more of it. The way I've been describing it more simply is it's faster, it's stronger, and there's more of it. So there's like 1,000 times more of this virus when they've done some studies compared to, again, the versions we saw like in 2020. And then it's also potentially stickier again, so it can kind of invade the lungs more, other parts of the body, and just cause more of a serious infection. So that's kind of, and then because there's more of it, it's interesting too. It seems like people are what we call incubating in a shorter period of time. So, people, it seems to be a shorter time after you get exposed to when you become infected yourself. And then you may be shedding for a shorter period of time though, which is another interesting thing that we're learning about. And I think a lot of this is still, like everything about this pandemic, is continuing to evolve. And I think that's the other thing, just back to messaging, I think we're not always the best at in public health and beyond, I think, but I have to continue to acknowledge that we're continuing to learn all the time, and things do change. And I recognize that makes it hard to trust the information when it keeps changing. So I would love more input from all of you actually too, on how we best navigate that and toe that line of, making sure we're being as honest as possible with giving the information we have, but also when it changes, being able to pivot and be transparent, but still maintain trust. So anyway, those are some highlights from me.
And on that same topic, I'm going to kind of jump around in the chat. There was a question that asked, does the regular COVID vaccine protect us all against the Delta variant? So I figured it's fitting since we were already discussing the Delta variant, but if you could shed light on that as well, that'd be great.
Yeah, I threw in a response in the chat, but what we know, in addition to being, stronger and faster, as we heard from Dr. Pan, the Delta variant is about twice as infectious as the previous variants. But the COVID vaccine is effective at preventing hospitalization and death. And so what we see is that individuals who are vaccinated are about, so individuals who are not vaccinated are about 5 times as likely to contract COVID and about 10 times as likely to be hospitalized and die as an individual who is unvaccinated.
Are there pros and cons for pregnant moms to get vaccinated, and where can they find that information?
can I jump in and say one thing, and then Dr. Pond, you can. So one of the pieces, so we know, and Dr. Pond has already shared the data, that pregnant women are more vulnerable to COVID, to getting severe COVID, and to being hospitalized, being in the ICU and dying. We know that. But on the flip side, I think so when a mom is vaccinated, it also protects the developing baby. And what the research shows is that when the mom gets vaccinated, she makes antibodies. And when that baby is born, those antibodies come out in the breast milk. And now it looks like maybe protective for the baby after birth when the baby is too young to be vaccinated themselves. So when we look at the data, it just keeps stacking up over and over again that it's a major risk to not be vaccinated as a pregnant woman, and it is protective not only to mom but also to baby, for mom to be vaccinated.
Yeah, and just really quickly on the heels of that, I would echo that strongly. And we've shown this already with prior vaccinations too. So again, back to flu, actually whooping cough, and you may have heard, in your other kind of, sort of educational information about all of this. So it's time and time again, and we are seeing this with COVID as well. So, and then my other quick comment, and then I know we do need to wrap, is I think other professional organizations, so public health organizations, so whether it's local, state, national, or professional medical organizations or professional clinical organizations, but it is really hard. I mean, there's so much, again, this literally this misinformation, this viral misinformation, and there's a lot of organizations that are starting to come up with names for their websites that look like they might be reliable. So I think it is really important for you all to help refer your clients as well to information that is at least vetted and valuable, so and valid and scientific and sort of based on rigorous data. So I think, again, a lot of the themes though are kind of known professional medical or clinical organizations, public health organizations, and I think, again, so much has been politicized, so I know it's really tough, and I think we've seen fallout, for example, of when there's political misinformation and then what's happening in the public health space or even professional organization space that try to push back on that. But, totally acknowledge that it's confusing. And on that note, you guys are such an important sort of trusted leaders for all of us in our state. So happy to come back again and do this in the future.